Welcome to BW Healthcare World. My name is Harbinder Narula. Just last evening, Aster DM Healthcare announced the Aster Guardians Global Nursing Award 2024 in Bengaluru. Today, I'm pleasantly joined with Miss Maria Victoria Juan, a military nurse from Philippines who is a winner of this global recognition, who was chosen among 78,000 applicants received from over 202 countries. Welcome, Maria, to this conversation with BW Healthcare World.
Mabuhay also from the Philippines. That means live, everyone.
Awesome, awesome. So, Maria, first of all, $250,000 and becoming a global superstar nurse. How do you
Yeah.
feel?
Still hadn't registered in my mind yet. I feel this is a dream and I'm gonna wake up to reality. But
Awesome.
little by little, I've come to reconcile with it. Oh, that this is must be true. Okay. Especially as I think this is an award not only for me personally, but for all the military nurses, even outside our country, and all the Filipino nurses and all the nurses in general. Thank you.
How will this impact you personally and professionally post receiving this recognition?
Okay, it literally will change my life. Okay. But because I have got more responsibility and more expectation, higher expectation, because this is a very high award. I think it's the highest award ever in history for it's dedicated for nurses. And I'm very thankful for the Aster Guardians for celebrating this with us, for honoring our nurses. The value of that money is not really, it's important, of course, but they put a value how significant nursing is to the world. It's as if I'm winning the Miss Universe contest, actually. And the way they treated us, it's as we are like a Miss Universe contestant. This is how awesome. It's from production to assistants to the accommodations, everything. Even our loved ones, it's also not left behind. This is how accepting your people here, the people here for the in honoring nurses.
I think it is well deserved. I think the nursing community deserves this respect and this recognition. But tell me one thing on a lighter note, what are you going to do with this $250,000 that you receive?
Of course, one thing I will offer for a Thanksgiving. It's very important,
Yeah.
right? To thank those who helped me because I cannot do it alone. I'm as a leader. I have a team. I'm not alone. So you
Mhm.
have to give this back to them. Share this recognition, share this award by offering a thanksgiving, of course, Almighty God, and to the person who supported me. And the next is, of course, plan for what will I do with a portion of that award prize to make sure that it really will help the Filipino people. And I already planned for two sets of critical issues, critical initiatives that I will work on once I get back to the Philippines right away.
That's a very beautiful thought, Maria. Maria, I'm sure you've come a long way from where you began your journey as a nurse. Now, tell me a little
Mhm.
bit about your story. How did it all begin? What motivated you to choose nursing it as a career in the first place?
Yeah. Actually, I've been in the nursing practice for maybe 36 years, but in military nursing practice is around nearing 34 years. Okay. Initially, as common to any teenager, I don't have any vision to be a nurse. I just joined the nursing practice mainly because I don't want to write a lot. I'm not a writer. I don't want to do math. Not knowing that is full of computations, that is full of writing, and but slowly I come to love it as I stayed in the nursing practice. I've come to love and be inspired by my colleagues, co-nurses, and of course the patients because what they give to us is that absolute trust, never been found in any other profession in which um they will make trust us with their body and the bodies of their loved ones. If I ask them to even to touch them or because of their absolute trust, and we give this back with just the three C's. And what are the three C's? Competence, compassion, and the courage to advocate for them.
That is very beautiful, Maria. Uh, every career evolves with time, and you said you spent about 36 years being a nurse. What
Mm.
changes have you observed in nursing from the time you began this journey to today, when you're creating, your career has brought you to a recognition of being considered as one of the top nurses in the world?
Yes, actually, there's a lot that there are so many changes. Like for example, we feel that we're before we're just subservient to the doctors, but eventually we come to collaborate with them. From being a subservient, we have an equal rank status with them, because right now the doctors are very open to collaboration, and the nurses are very good at performing some initiatives, creating with initiatives. So we build their trust because of that. We become courageous in advocating for our patients, and with that, we try to research more to find out, to benchmark from other countries or the best practices there. And because of that, we build trust. So the doctors trust us, and we trust them, and together we collaborate to enhance the health services.
Mhm. And, Maria, typically when we look at nursing from a layman's perspective, we see of nurses working in a typical hospital, you know,
Yes.
but you have also had a lot of experience as a military nurse. If I'm correct,
Yes.
you accomplished the something called the aeromedical evacuation training,
Yes.
which is
Yes.
a different ball game altogether. Can you tell us about your
Yes.
experience as a military nurse and this training? What did you have to go through, and were there any fears that you had, which you had to
Yes.
overcome as a part of your
Yes.
journey?
Yes. Actually, military nursing is the most adventurous, full of new settings, because we do not only give care in a conventional setting like the hospitals, clinics, or infirmaries. We also give care in the unconventional, in the combat zone, in the aeromed, in the airplane, in the helicopters. There are a lot of things we can do that is not common to any regular nurse. And but then the military nursing practice is so organized that all of us are required to hone our practice in clinical first. We have to have our own specialty, whether in the operating room, whether in my case, I have a specialty in neurosurgical nursing. So we have to hone that after we become leaders, because we have to start from the grassroots, because eventually we're going to be a leaders in healthcare system along with our colleagues and the doctors, the dental. So we have to have a deep understanding of how the healthcare works in the military. And what are the challenges as being a female and a predominantly male organization, it would be hard because of some gender issues. But in the case of the armed forces, there are literally no gender issues, mainly because they assess you how you perform, not what your gender is. If you're a good leader, whether you're a man, a woman, then they assess you meritocracy according to your merit. And also, I learned from the great characteristic of a male as a leader. They are mission-oriented, they are direct, they are decisive, which is a bit contrary to what a female is. Like, we are more emphatic, compassionate, tend to rely on relationship. But then when you combine them together, they are a force to be reckoned with. So instead of going against them, why don't you complement? And learning from that, I learned to think like a man, but act like a lady still.
But did you get to learn some attributes of being a soldier? Because, when you're working in an environment which is not as conducive as an hospital, where you may be working in a very adverse kind of an environment where speed is of essence. So, what were the kind of things that you learned which you otherwise would not have learned?
Okay. Actually, we were indoctrinated how to act like a military officer. Okay. So we have training, 3 to 4 months training, non-nursing focus. All military. We learn rappelling, we learn map reading, we learn shooting with a long arm, short arm, assemble, disassemble, how to fix them, how to sleep in a hostile environment. They teach us all because we are sharing their uniform, and we sometimes we are going with them to rescue them, to take care of them in a hostile environment. So we should know how to protect ourselves and how to protect them. If you don't know how to shoot a gun when there's an enemy, then we will be a detriment to them. So we have to really act like a military and still retain our being a nurse.
So tell me one thing, Maria, what are the kind of learnings that you have had in a military environment which you think are the skills which every nurse should be taught? And I'm not talking of, in a hostile environment, but in terms of did it help you become stronger mentally, emotionally? And what are the kind of learnings that you have which you can share with other people who otherwise work in a hospital environment?
Actually, as I said, only focus on the three C's. If you are so confused, focus on the three C's. Be competent in what you do. Competence just means doing 100% what is expected of you, whether you are a leader, you're a staff nurse, what is expected of a staff nurse, what is expected of a chief nurse. So focus on that and do it 100% for you to be competent. If you do that, it would be easy for you in decision making, being alert, whatever the challenges will eventually come to you, you already know what to do because you're already physically, mentally prepared. Then, of course, do not forget your compassion. It's not all about skills. You also have to have the heart. Even if you have just to listen, be present in your patient, it is enough for them. Talk to them, let them verbalize feelings. That's it. That is great for them already. And of course, you must have the courage. If you are already compassionate, competent, you don't have the courage to advocate for them, you cannot get any transformation, any changes. If you're so afraid, if you're so shy. Right.
And how do you think now, when you are equipped with this recognition, will you be able to impact and support the community of nurses in the region that you work?
Yes, actually, even before I won, I'm already making changes along with my team. I am just a representative of those like me. It just so happened that I was recognized here, but there is a lot of military nurses who are like me, who are advocating, who are having an impact in our organization, and much more with this platform, with this advocacies, which is around the world. I could have more power because they will believe me right away because being the Global Nurse Award. Okay, so I don't have a hard time in pushing for these advocacies. So I guess I'm very excited to go back home and start planning how to impact our society.
That's beautiful because, you're absolutely right. Now people will listen to you because they've seen you being recognized. But, Maria, what do you think about this platform which Aster Guardians has created? What do you think will be the long-term impact on the nursing career in the future?
Wow, I think it's very profound. This kind of award, which is the biggest, the highest, even topping the Miss Universe, I think it's going to inspire many nurses that I can tell them that you start one step at a time. It doesn't have to have you don't have to have a great accomplishment right away. I did it for how many years? I started with just one step, one belief, one vision, and that's through the years you're going to add up to it as long as you're focused. If you have so many things to do, you tend to not finish it. Just have one focus that is valuable for you, you think is valuable, not only to you, but to the society, and focus on it. And don't be afraid. Have the self-confidence. You can do so many things. We, as nurses, we have great potential to transform not only the ward, not only the hospital, but the whole community itself. Just believe in yourself.
And, I have a very pointed question. Nurses typically have to work odd hours. They have to, work long hours. They have to do shifts which are night shifts, etc.
Yeah.
And there's a concern around the safety of the nurses, specifically the women nurses. Is that an issue which is across the world, or is it more in these developing countries? What have you observed, and what do you think the healthcare institutions need to do to make the nurses feel safer at work?
And actually, there are isolated cases right now, but as the years go by, it dwindles. Why? Because the nurses are more, they speak up of these concerns. And the healthcare industry right now are listening. So that's why if we don't speak up that we have concerns about security, nothing can be fixed. But you're so afraid to do something about it, to say, just initially say something. And eventually, if there are a lot of voice saying the same thing, the healthcare industry, the administrator will effectively respond to it. And right now, I see it. It must start with a one voice first.
This brings me to a question, Maria, because nurses work with two most important and imperative stakeholders in outcome of healthcare delivery, which is the doctors. They spend a lot of time with the doctors, and second is the patient. And it can be
Mm-hmm.
tough because what is the most difficult situation that you have probably faced in your journey so far as a nurse, and what would you like to share something with us about that situation?
Yeah. Initially, because I have been in the service for 30 years, there was a tendency to have a culture of the nurse being subservient to the doctors. But through the years, as they develop trust and as they know that, oh, the nurses are really confident, they can do some initiatives. They build trust on us. And because it must come from us first. Because they won't believe that if we don't have any, if we are not performing, if you're all also thinking of us as being just as subservient. But if you think that you're a team, you're collaborative, that is your relation between the doctors and the patient should be involved also in their care. Do not just surprise them that this is the care you will have. No, you have to involve them. So it will be customized according to their needs. So if you do those things, collaborate, do not fight with them because the doctors are really, we need it for medical regulations, for medical directions. We cannot prescribe. Up to now, the Philippines cannot prescribe, the nurses cannot prescribe medication. We cannot diagnose. We need the doctors for that. So we have dependent practice and we also have independent practice. We don't have to ask for their medical direction to alleviate the fever, so or to give comfort. So if you recognize this and respect the doctors because they really have the legitimacy to really give orders. If you do that, respect, and also the doctors respect the nurse, and we'll have a very great healthcare environment.
And Maria, before I let you go, I'm really intrigued to ask you that what would you like to say to all the girls and women out there who want to become, who want to become nurses, but are hesitant, not knowing much about the career progression that they can expect? How can they overcome this element of being unsure?
Hmm. Coming from having a vast experience about nursing, and I know where that came from because when I graduate, I'm not sure what to do with my life. And I think that's everyone's because we're still a teenager, we're still new adults. We don't have any vision at all. It's all right. But if you're hesitating, because in the Philippines we need parang we're expected to have an education, a bachelor education, an academic education. So we start with nursing. It can never go wrong. Why? Even if you want to be later on an engineer, a pilot, an entrepreneur, if you start with nursing, because health is the greatest treasure. Not money can buy nothing. And health, if you're a nurse, you know how to keep yourself healthy, how to keep your loved ones healthy, and go on from there. If you want to diverse and be a pilot and be an, if you're still hesitating, just be a nurse. Once a nurse, always a nurse.
Maria, it has been such a pleasure speaking to you. You know,
Mm.
uh, it's beautifully how you brought out the underlying emotions that you trigger as a nurse among your patients, which is of trust, which is of faith,
Yes,
and which is
yes,
of empathy. And one of
yes,
the two things that you do to make the recovery quicker for a patient is by adding joy and happiness and making the journey of recovery happier and pleasant than what they expected. And you
yes,
beautifully brought out the three C's.
yes,
It was competence, compassion, and the courage to do what you're expected to do. You know what,
yes, yes.
Maria, you have made the nursing community proud across the globe. Thank,
Wow, thank you so much. Thank you so much. Namaste.
thank you. Thank you.